Suicide is the leading cause of death in Australians under the age of 45. Individuals that are significantly affected by suicide can range between 5 within the immediate family and close friends and relatives, but up to 135 individuals in the broader community. So this can include first responders such as police, individuals within the workplace, and also young people within schools. Individuals that have lost someone to suicide experience significant risk of suicide themselves and can experience significant mental health difficulties that persist for many years after their loss.
Back in 2016 we became aware of a number of losses for young people by suspected suicide. There was anecdotal stories linking these young people. We felt very powerless about how we could potentially stop future suicides happening. So we were able to work to develop a role for one person who was going to be able to navigate and coordinate the responses that individuals needed.
My primary role is to contact family and friends who are impacted by that loss, and that is to check in with them around their needs, and primarily that is around financial needs, day-to-day living necessities, food on the table, that kind of thing. Do they need assistance with funeral planning, end-of-life processes?
In nearly all suspected suicide deaths, the police attend to the next of kin, and we've worked very closely with Mandurah Police District so that those police officers are orientated to be able to speak to the bereaved and let them know that there are some specialist services available.
To have support offered proactively, that they haven't had to go and find themselves, they're in the comfort of their own homes. To be able to have that initial conversation, to be able to talk about what it was like this week, this few days, and the early support offered, it reduces the isolation, it identifies suitable supports for people early on, but more than that, it is about helping the person to establish coping.
We're able to help them remain connected with their community, helping them maintain healthy relationships, helping them get back to work and be productive. We're reducing the burden of health and helping people grieve healthily.